Hey, beautiful people. Are you tired of dealing with breakouts, dull skin, and those pesky dark spots? Well, you're in the right place. Today, we're diving into the ultimate guide on how to keep your skin clear and healthy. We'll cover everything from understanding your skin type, establishing a solid skincare routine, and the importance of hydration and diet, to lifestyle choices that can enhance your skin's health. We'll also discuss how to prevent sun damage, treat sunburns, and identify different types of acne scars. Plus, we'll go over how to prevent and treat existing acne scars, and how to avoid hyperpigmentation. Whether you're a skincare newbie or a seasoned pro, there's something here for everyone. So grab your favorite drink, sit back, and let's get started. And don't forget to check the links in the description below for some of the skincare products we'll be mentioning today. 1. Understanding your skin type. First things first, let's talk about skin types. Knowing your skin type is crucial for choosing the right products. There are 5 main types: normal, balanced moisture, few imperfections; oily, shiny, more prone to acne; dry, flaky, rough texture, may feel tight; combination, oily in some areas, dry in others; sensitive, prone to redness and irritation. Identify your skin type to tailor your skincare routine effectively. If you're unsure, consider consulting a dermatologist. 2. Establish a skincare routine. Now that you know your skin type, let's establish a solid skincare routine. Here's a simple breakdown. Use a gentle cleanser twice a day to remove dirt and makeup. For oily skin, look for foaming cleansers. For dry skin, opt for creamy, hydrating ones. Exfoliate 2 times a week to slough off dead skin cells. Use chemical exfoliants like AHAs and BHAs for a gentle yet effective approach. A toner can help balance your skin's pH. Look for alcohol-free formulas packed with hydrating ingredients. Never skip moisturizer. Even oily skin needs hydration. Choose lightweight, non-comedogenic products. Last but definitely not least, use sunscreen every day, even if it's cloudy. SPF 30 or higher is ideal to protect against harmful UV rays. 3. Hydration and diet. Let's talk about hydration and diet. What you put in your body can reflect on your skin. Here's how to keep it glowing. Stay hydrated. Aim for at least 8 glasses of water a day. Proper hydration helps maintain skin elasticity. Incorporate plenty of fruits, vegetables, and healthy fats. Foods rich in antioxidants, like berries and nuts, can combat skin damage. Cut back on sugar and refined carbs, which can lead to breakouts. Instead, opt for whole grains and lean proteins. 4. Lifestyle choices. Your lifestyle choices play a significant role in your skin's health. Here are some tips. Aim for 7 to 9 hours of quality sleep each night. Your skin repairs itself while you rest. High stress levels can trigger breakouts. Consider practices like yoga, meditation, or even simple breathing exercises. Keep those hands away. Touching your face can transfer oils and bacteria, leading to breakouts. 5. Preventing sun damage. Now let's discuss an essential topic: preventing sun damage. Protecting your skin from UV rays is crucial for maintaining its health and preventing premature aging. Use a broad-spectrum sunscreen with at least SPF 30 every day. Apply it generously to all exposed areas, including your face, neck, and ears. Reapply every 2 hours, especially if you're swimming or sweating. Consider using a setting spray with SPF for easy touch-ups. Whenever possible, stay in the shade, particularly during peak sun hours from 10 a.m. to 4 p.m. Opt for long sleeves, hats, and UV-blocking sunglasses. There are also fabrics specifically designed to block UV rays. Remember that UV rays can reflect off surfaces like water, sand, and concrete, increasing your exposure. 6. Treating sunburns. Even with the best prevention, sunburns can happen. Here's how to treat them effectively. Take a cool bath or shower to help soothe the burn. Avoid hot water, as it can irritate the skin further. Apply a gentle, hydrating moisturizer or aloe vera gel to the affected area. This helps lock in moisture and promotes healing. Drink plenty of water to help your body recover and rehydrate your skin from the inside out. As tempting as it might be, don't pick at peeling skin. Let it fall off naturally to avoid scarring. If needed, take over-the-counter pain relief medication like ibuprofen or acetaminophen to reduce discomfort. If your sunburn is severe, blistering, or accompanied by fever, consider consulting a healthcare professional. 7. Identifying different types of acne scars. Now, let's identify the different types of acne scars. Understanding the type of scar you have can help in determining the best treatment options. These are the most common type, characterized by depressions in the skin. They can be further divided into atrophic scars, ice pick scars, deep narrow pits that resemble ice pick marks, avascar scars, wide depressions with sharp edges, resembling chickenpox scars, rolling scars, shallow undulating scars that give the skin a wavy appearance. These scars are raised and occur when excess collagen is produced during the healing process. They can be firm and may fade over time. These are similar to hypertrophic scars, but extend beyond the original wound site. They can be itchy and may require medical treatment to reduce their size. 8. Preventing acne scars. Next, let's talk about preventing acne scars. Scarring can be a common concern after breakouts, but there are steps you can take to minimize your risk. The sooner you treat a breakout, the less likely it is to leave a scar. Use targeted treatments with active ingredients. Resist the urge to pick at pimples. This can lead to further irritation and potential scarring. Exfoliating can help remove dead skin cells and promote skin renewal. Opt for gentle chemical exfoliants instead of harsh scrubs. Look for products containing ingredients like niacinamide, vitamin C, and hyaluronic acid, which can aid in skin healing and reduce the appearance of scars. Maintaining good hydration and a healthy diet supports overall skin health, promoting faster healing. If scarring is a concern, consider professional treatments like microneedling, chemical peels, or laser therapy. 9. Treating existing acne scars. Now let's focus on treating existing acne scars. If you're dealing with scars from past breakouts, here are some effective methods. Topical treatments look for over-the-counter or prescription retinoids. These promote cell turnover, helping to fade scars and improve skin texture. AHAs, like glycolic acid, help exfoliate the skin's surface, encouraging new skin cell growth and reducing the appearance of scars. Salicylic acid is a BHA that penetrates deeper into the pores, helping to clear out blockages and reduce the risk of future breakouts. Chemical peels. These use milder acids to gently exfoliate the skin. They can improve texture and lighten dark spots with minimal downtime. These are more intensive and require more recovery time, but can significantly reduce the appearance of scars by removing the outer layers of skin. Microneedling. Microneedling uses tiny needles to create micro-injuries in the skin, stimulating collagen production. This can improve the texture and appearance of scars over time. Multiple sessions may be required for optimal results, and it's essential to follow up with proper skincare post-treatment. Laser therapy. These remove the outer layer of skin and are effective for deeper scars. They require more downtime but can produce significant results. These lasers stimulate collagen without damaging the surface. They have less downtime and can improve texture and tone over time. Dermal fillers can be injected into deeper scars to raise them to the level of surrounding skin. This is a temporary solution that may need to be repeated every few months. Hyaluronic acid fillers are commonly used due to their natural appearance and compatibility with the skin. Patience and consistency. Remember, treating scars takes time. Be consistent with your skincare routine and give treatments time to work, often several weeks to months. Regular follow-up with your dermatologist can help adjust your treatment plan as needed for the best results. 10. Preventing hyperpigmentation from acne. Now, let's discuss preventing hyperpigmentation from acne. Dark spots can often be a result of inflammation from breakouts. Here's how to minimize your risk. The faster you address a breakout, the less likely it is to cause hyperpigmentation. Use anti-inflammatory treatments to reduce redness and swelling. Always wear sunscreen. UV exposure can darken existing spots and lead to new ones. Make SPF part of your daily routine, regardless of the weather. Look for products with vitamin C licorice root extract or kojic acid. These ingredients can help brighten the skin and reduce the appearance of dark spots. Picking can lead to inflammation and increase the risk of hyperpigmentation. Keep your hands off your face. Exfoliate regularly to promote cell turnover. This can help fade dark spots over time. Use gentle chemical exfoliants to avoid irritation. If you're concerned about hyperpigmentation, a dermatologist can recommend treatments tailored to your skin type. 11. The importance of consistency. Lastly, remember that consistency is key. Skincare isn't an overnight miracle. It takes time and patience. Stick to your routine and you'll see results. Did you find these tips helpful? If you did, don't forget to hit that like button, subscribe for more skincare tips, and comment below with your favorite skincare hacks. Let's keep this conversation going. Until next time, stay radiant and remember, your skin is your best accessory. Bye.